please ask your questions in the chat box. So in the chat box, we will have the interpreters, our Spanish interpreters, will be able to see those and translate them, or Ms. Maria Gutierrez will translate them. And then we will have time at the end set aside for questions. So all of your questions will be answered. They'll just be answered at the end. We do also have some online questionnaires that I will be sharing in just a second. I have to pull them. I realized that Maria very kindly reminded me to do that before the meeting started, and I still did not do it. She's so nice to me, and somehow still I don't do what I'm supposed to do. So I will be doing that in just a minute. These questionnaires are important. We have two different questionnaires. One questionnaire will be about your general understanding of or ideas about sexuality and relationship education. And then one is going to be a feedback form, which you'll fill out at the end of the presentation for the Alabama Council on Developmental Disabilities. They are our funders, so they are the reason that we can have such wonderful guests as Ms. Katherine McLaughlin and our other speakers that we have had. They support our interpreters, both Korean and Spanish, depending on the presentation. And so we're very grateful. But the more information they have about us, the more they hear our H-Trans name or Dr. Doris Hill's or Maria Gutierrez or my name, the more likely we are to be able to continue to get funding for these kinds of activities. So we would greatly appreciate it if you would fill those out. And they will be in the chat box once I get my life together and put them in there in just a little while.
They're already there, Dr. Drew.
Oh, see, look, Maria to the rescue. Oof. I don't know what we would do without her. So as for introductions, I am Dr. Christine Drew. I'm an assistant professor at Auburn University in special education. I research challenging behavior in adolescents with intellectual and developmental disabilities, and also sexuality and relationship education. And I'm very lucky to work with Maria and Dr. Hill. They are wonderful. And I've also been very fortunate to be able to take a class with Katherine McLaughlin, our speaker today, a 3-day class online, which you would think would be so boring. You'd be so tired. Nope. Nope. It was so engaging. It was so interesting. I had such a wonderful time. I really cannot recommend her training highly enough. I talk about her company ELEVATUS training all the time at conferences and when I speak to people about this, because there's just so much good information that they have and are willing to share. So I am so appreciative of everyone. So Dr. Hill.
Hi, I'm Doris Hill. I'm an associate research professor and the director of the Regional Autism Network at Auburn, and I'm one of the primary investigators on this grant. And I did want to say this is not a 3-day training. It's going to be about 90 minutes, maybe close to 2 hours, depending on questions. So welcome, and next is Maria.
Good morning, everybody. My name is Maria Gutierrez. I am the family navigator for the Regional Autism Network at Auburn University. We cover 20 counties, so we are the largest region in the state. So we are so excited to see professionals and parents from all the parts of the state. So thank you for taking time of your busy Tuesday to be here. This is our second session of the month. The first one, it was conducted on February the 11th, and we were able to provide Korean and Spanish interpretation. Today we'll have only Spanish interpretation, but we hope that our Korean attendees will stay and let us know if you guys have any questions. So thank you for being here. And I would like to know if our attendees could put on the chat box if you are a professional and what agency are you joining us from, and if you are a parent, and which county are you joining us from. So thank you so very much. And now Ms. Katherine.
Great, thank you. It's great to be here, and my name is Katherine McLaughlin, and as Christine mentioned, I have a company called ELEVATUS Training. And the reason that we named it ELEVATUS Training is that a lot of my work is to elevate the status of people with disabilities. So we came up with ELEVATUS Training, and my work is really around how do I help other people address sexuality? since there's such a need for people with developmental disabilities to get information, how do I help others get more comfortable and being able to address it in their communities as well? And I also am doing some work with the DD Council in Michigan and New York as well. So the DD Council seems to be taking on this topic themselves as well, which is wonderful. But some of the work that I've done in particular is I wrote a curriculum on sexuality and developmental disability. And the time when I wrote it, there weren't a lot of resources available to teach the topic. And so the idea was, how do I create something that other people can, attend a training and then pick up and use to support either parents or staff or people with disabilities directly. So today, the focus is more around how to partner with parents to support their child's sexual development. So I know that there are some parents here as well as professionals. And so it'll be sort of a cross training where professionals might have questions for parents, parents might have questions for professionals, and we'll learn together no matter who we are. So that's the plan. And I think an important point for us to talk about, like if you're talking with a parent and helping them learn about sexuality and talking to their own children, or if you're a parent yourself, it's really important to talk about sexuality with our children. And in particular with children with developmental disabilities, because many don't receive sexuality education in the schools. So you might be well aware of that with your own children, or people with disabilities telling you as adults that they didn't get any kind of sexuality education. And I work with a group of self-advocates, people with disabilities, and they talk about being in the mainstream health class, learning about nutrition, learning about physical activity. And then as soon as the sexuality and relationship unit starts, they're removed from the class. So it's important, one, for schools to actually address this topic, but if they're not, even more of a reason for parents to talk to their own children. I think it's also important because it helps combat some of those unhealthy messages from the culture. So we get a lot of messages from media and internet around do it, those sorts of things. And so for parents, it's really helpful to have their perspective given to their own children about these different messages and to give healthy messages around sexuality. It also normalizes the topic, just like we talk about, making our bed or cleaning the house or going to the doctor, anything, it's just part of our conversations as families. So it really normalizes things as well. And then people aren't so uncomfortable talking about it if we've normalized it. Also, when parents talk to their own children, it shows that they're open to hear about this. There was a study done years ago where they asked adolescents about did they talk to their parents or not about sexuality. And the ones that talked to their own parents described their parents as the reason that they talked to their parents was their parents were open. And the researchers didn't ask, are your parents open? But many of the adolescents talked about this sense of openness. And so if a child feels that you're open, then they can really trust you and they can come to you with things and know that you'll discuss them with them as well. It's also an opportunity to express your values with your kids about sexuality and relationships. So what do you believe? That's our job as parents, is to share our values. And so that's an opportunity to share your values when you're talking with your child about sexuality. It also increases sexual health, and I'll talk about what that is, as well as reduces sexual abuse and some of the negative things that can happen when someone's in a sexual relationship. And, another thing is when we talk about sexuality, and even for parents, I got to talk about sex. that's a piece of it, but it's so much more than that. So I think that's one thing, is to dispel that myth that really sexuality means a lot more than sex. So it's about intimacy, connection, and belonging. So how do we help our children feel close to others, feel a connection, feel like they belong? That's part of sexuality education, as well as what are the different kinds of relationships that there are, friendships or sexual romantic relationships, what are, or a teacher, a helping professional, or a casual friend, and what are all the different kinds of relationships, and how do we interact in those relationships? It's also about how we feel about being the gender that we were assigned, our gender identity, as well as our sexual orientation. So that's a piece of sexuality. It's also about how we feel about others and ourselves, you know, our self-esteem, our body image. That's a part of one's sexuality. And it's also about sexual expression and behavior. So it's a big part of who individuals are. And oftentimes people will say, but you know, if sexuality is about being in sexual romantic relationships, what about children? How can we talk with them about sexuality? You know, young children. And you know, we may not talk about, you know, it's always age appropriate information about sexuality and relationships. So we can talk about connection and belonging and relationships and bodily autonomy and privacy with young kids. We may not get it. We'll talk about reproduction, how babies are made, but we may not get into all the different sexual acts until somebody's much older. So it's age appropriate sexuality information and education. So everyone is a sexual being from birth to death, but that doesn't mean that they're having sex. That means that they have a sexuality. And then as far as sexual health, and I think when we're working with parents, you know, we want to describe what this means. And I think Laura probably used a similar definition when she did the parent, you know, how to talk to your own kids about sexuality. But really, what we really want is for our young kids to be very, you know, have a healthy sexuality or be sexually healthy. And that means feeling good about and understanding their bodies. It means feeling about who you are and having high self-esteem, feeling good about your gender identity and sexual orientation, having relationships that are positive and pleasurable and not exploitive, having information to make healthy decisions in your life, and how to avoid sexually transmitted infections, unintended pregnancy, and other challenges that might come up when you're in a sexual romantic relationship. So as I said before, the focus for today is we're going to look at examine effective strategies, techniques, and resources to partnering with parents. So how do you partner with parents around helping them talk to their own child about sexuality? And we're also going to look at some effective tool for responding to behaviors. So this is something that you can share with parents. If you are a parent, you can use this tool as well. So I like to have a few group agreements, especially when we're talking about sexuality and relationships. And so just the first one is respect differences of opinion or different values, that all values are okay. And that we want to respect different opinions, values, beliefs. Also confidentiality. And so what I like to say, stories stay, lessons leave. So if somebody brings up a particular story, we don't share that story outside of here, but we can share what we learned from hearing that story. There's no such thing as a stupid question. If you have the question, please ask. Like Maria said, put it in the chat and we'll make sure your questions get answered. And have fun too. You know, this doesn't have to be a very serious day, but have some fun and ask questions and take a risk around asking a question. So in the chat box, what I'd like you to do is, if you could write the answer to this question: what was the primary message that you received about sexuality while growing up? So what message did you get about sexuality? and I'll watch and see what people put in there for answers. So what message did you get? It could be a verbal message or a nonverbal. So forbidden topic from media. Everyone is having sex. You're behind. Yes, it was wrong. Don't do it. Almost nothing. Yeah. Yeah. So lots of different sex is bad. Don't lead them on. So some messages maybe particular to females around leading people on, or yeah. So a lot of negatives, a lot of negative messages. So what we want to do is encourage parents to give positive messages about sexuality and to change that so that people are getting, sexuality is a healthy, normal part of one's life. It's okay to have sexual feelings and to have questions about it. So we just want to, make sure that we're giving positive rather than these fear-based messages around sexuality. So that's really the first thing that we can do. So we want to either, as parents, give positive messages or help parents look at the messages they received and how they might be giving negative messages. So for me, it was taboo. It was conveyed as something bad. Yes, right. So the other question I have for you is, what are the reasons it can be difficult for parents to talk with their own children about sexuality? So if you're a parent, what makes it difficult for you to talk to your child? And then if you're a professional, what do you think is the thing that, what do you think is difficult for parents? Okay, I see a question. I'll address that in a minute. Fear of messing it up is what I've heard from parents. Okay, yeah, like not doing it right or saying the right thing or maybe somehow encouraging. No one talked to them. Exactly. Yeah. So there's a lot of barriers, overwhelmed by all the other things they're having to attend to, believing that their child with special needs will have a sexual life. Yeah, so that would be a positive message too. Yeah, so I think the question is, how do you give positive messages without encouraging sexual behavior? So it's interesting because when we look at, for example, Denmark, very different country than ours, they talk about sexuality early on in life. And they talk about how babies are made, and every kindergartner learns about how babies are made. And then when you hit puberty, they talk about sexuality in a really positive way. And yet they have the same sexual activity rate that we have here in this country, but way less unplanned pregnancy, way less sexually transmitted infections, way less abuse. So talking about it does not encourage. And really what they find is that parent-child communication, kids whose parents talk to them about sexuality are more likely to wait to be sexual. And if they are sexual, more likely to use protection. So I think it's a kind of a myth that if you talk about it, it might encourage. Talking about it also means giving your values. So saying things like, I think you should wait, or I think it's important to be in a relationship where you feel really respected, whatever your values are. That's an important piece about talking about it as well. So I just want to read what else we might have here. Afraid that they will not truly understand. Yep. So maybe not sure that their cognitive level is such that they'll understand what they're saying, or will they really, understand? That can be an issue. Or I'm afraid of how can I teach him those things? I'm afraid of, so how do you teach this sort of thing? And especially if it's such a private topic, how do you do that? So lots of barriers for people. And hopefully I answered that question around positive messages. So please add more questions to the chat. But what I like to use this behavior change model when I think about parents. And if you're a parent, you could sort of stage yourself here. If you're a professional, you can think about some of the parents that you're supporting and where they might be in the stages of change. So this is a theory that's used for changing behavior around health risk. So James Pachaska and Carlos Di Clemente, they formulated this stages of change. And how they did it was they talked to people who would quit smoking on their own. And what they found is that people go through certain stages when they're trying to change a health behavior. So I think it's a great model to use even in assessing ourselves as parents or the parents you're supporting. Where are you in accepting your child as a sexual being and wanting and knowing that it's important to talk about this? So and I'll go through the different stages and you can think about where you might be as well. But pre-contemplation is the person is not thinking of their child as a sexual being, really doesn't want to talk about it, doesn't want to open that can of worms, really pretty resistant and worried, very worried about their child and wanting to protect them and feel like, I don't want to go there. And so that would be a parent who's in pre-contemplation. Parents who are in pre-contemplation, usually what moves them from that stage to the next is some kind of emotional experience. So for example, let's say that you're part of a class, and there's other parents there and someone brings up the topic of, I didn't even know my daughter was sexual until I found out that she was pregnant. Right? And then you start to think, ooh, gosh, maybe I should talk about this. You start to feel like it's more risky to stay where you are and say, I don't want to talk about it. So usually it's some kind of emotional experience. So that moves you into contemplation. Then contemplation is where parents are very ambivalent. They feel like, I don't know, maybe I should, maybe I shouldn't. I'm just, I worry. I'm not sure it's such a good idea. And just really, just really unsure. Is this the right thing to do? And with this group of parents, what can really help is a pros and cons, looking at all the positive things that could come out of talking to your child about sexuality. What are all the positive things? Your values, they'll hear your values about things. They'll get accurate information. They'll feel like the lines of communication are open and they can ask you anything, right? So we try to brainstorm as many positive things that could come out of it. And then what's the negative? What would be the negative thing that could come out of talking to your own child about sexuality? And the fear might be something like it'll encourage them to have sex or something like that. And so we want to dispel that myth and say it actually won't. And think about some of the things I said earlier in response to that question. So we want to get as many pros as we can and counter the cons. And if we've got more pros than cons, people are ready to make that next step into preparation. So preparation is the parent is ready. They're like, oh my gosh, I need to talk about this. What do I do? Do you have any resources? Help, help, help. And this is the easiest person to work with, right? Because they're ready. And so we can share resources. And I did share a handout on parent resources. You can share those. If you're a parent that feels ready to talk about it, there's a resource list for you. So we just want to help people have a plan and get the resources they need when people are in preparation. And then action is you tried it out. So parents have started talking to their child about sexuality. That would be, they're in the action stage. So we want to support them. If something doesn't go well, we want to help them figure out what didn't go well and, figure out what to do next time. And then maintenance is they've been talking to their child about sexuality for a long, long time. So they're really confident. This would be a great person. So the parent workshop we did a couple of weeks ago where Laura presented, she is a parent in maintenance. She has a child with a developmental disability and she talks about it with her child and now she's leading workshops. So if you know of people, parents who are in maintenance, they would be a great person to talk with other parents about it as well. So just one thing is sometimes people recycle back in the stages of change. So let's say they start talking to their kid about sexuality and then something happens. They kind of, they retreat usually back to contemplation. Like, I'm not sure this is such a good idea. And we can say, I know, things aren't perfect. There's so much to learn, and let's talk about what happened and what you could do different next time. So that's a natural thing to recycle. And you can also think about it for your own health risk behaviors. Are you someone who smokes cigarettes? Are you someone who doesn't exercise 150 minutes a week? Yes. Where are you in this? And that you might have these attempts and recycle back, but that's normal. Rarely do people start at pre-contemplation and go all the way through. Another thing with pre-contemplation, parents and pre-contemplation, is talking about the rates of sexual abuse, because that is a #1 concern for parents. And so when they realize that their child is really at risk, sometimes knowing those statistics helps them realize, gosh, I really should at least go to contemplation and consider talking about this as well. So let me see, yes, 7 times as likely, exactly. And for females with developmental disabilities, 12 times more likely to be abused. So let me just look at some of these questions. But how can I really work with my child since he's still very young, 6 years old, and has a severe ID and ASD diagnosis? Yeah. So he's 6 years old. Is that what you're saying? Yeah. So for 6-year-olds, and I don't know him to know exactly how, what his disability is like, but we want to focus on topics like public and private, and what kinds of relationships, and how do we touch people in those relationships, and bodily autonomy. It's okay, it's your body, you get to decide what's right for you. So we don't want to make our children hug someone because we don't want to hurt their feelings. So there's lots of ways to talk to young children. Use the correct terminology for body parts so that he knows what his body parts are and what they're called, and who's allowed to touch their body parts as well. So it really, when they're young, it's no one unless you need help bathing and they're helping you bathe, or it's a doctor and they're helping you stay healthy as well. But really no one else should be touching a young person's sexual parts. A child can touch their own sexual parts, but that would be in a private place. So I think those kinds of messages are really helpful. How are babies made? And it can be very simply, an egg and a sperm came together and that's how a baby was made. But again, I don't know your child well enough to know exactly how to do it, but I think about how you teach him other topics and then insert these topics as well. So another question is, in my culture, this is a taboo topic and I don't feel prepared to teach him. I have no male person in my family that can help me. Any ideas? Yeah, that's a great question. When I first started teaching this topic, I bought puberty books for males for myself, since I hadn't gone through puberty myself as a male. I wanted to know more about it. So that I would recommend that too, to really kind of understand what is it like for a male. And really, men or young boys, males, often go to their mothers more so than their fathers anyway. So for some reason, they feel more comfortable talking to women about it. I'm not saying all fathers, but I think it's okay as a mother to talk to a son about sexuality. But like you said, you might want to get more prepared and learn more yourself about how to talk about being a boy, being a man. Yes. And then Christine wrote, that happened to me. My mom's coworker's daughter got pregnant and suddenly she told me that I should tell her if I was pregnant, except I didn't even know how to tell if was pregnant, right? Yeah, so your mom got a message from a coworker, and then your mom kind of panicked. Yeah, exactly. Yep. And then another question is, I'm very concerned regarding my daughter having her first period. I don't know how to address this event that will happen to her, as she's nonverbal, no potty training, and lots of sensory issues. What recommendations can you provide? And should I request the pediatrician to give some medications to stop her period from coming? Please don't judge me. Of course not. Of course I don't judge you. I think these are really good questions. And, some parents do decide to do medication to stop her period from happening because life is complicated. And I think it's something to consider, and a choice that you have to make as a parent. I would talk to the pediatrician about it as well, about whether that makes sense. And as far, I don't know how old your daughter is, but a pediatrician can also tell you approximately when it might start to happen as well. And so usually, in general, if she has breast buds, her breasts have started to grow, menstruation usually happens about 2 years later. So I don't know if her breast bud, so I think knowing when it might happen would be a good conversation to have with a pediatrician as well. And then as far as potty training, so you're sort of thinking about how would she change pads and things like that? Is that kind of the issue? I'm sort of assuming that. So a little more would be helpful around that as well. And a Spanish books that you can recommend. I know that Laura provided some Spanish resources. Is that right, Christine?
She did, and Maria sent those out, I believe, in an email to the listserv. But if you did not get those resources, you can email Maria directly and she can forward it to you. We do encourage everyone to be part of our listserv because we send out a lot of really great information, including the flyers for this talk and other talks. So if you want to be added, you can put your name in the chat or Maria can send you the information.
Dr. Drew, at the end of today's training, I will send a copy of the handouts along with those list of resources to everybody that attended the meeting. So thank you.
Great. Yeah, the handout that I have for this one is all in English, but I think Laura had some Spanish ones. Yeah. Great. All right. Looks like there's some emails in there for you. I think I've got everything. Yeah, so let me know if there's more questions about that particular one around menstruation. But I do know other parents have considered this, and no judgment. I think we all make different decisions for our children based on what works for us. So that is something to absolutely consider. And I've talked to parents who have chosen that and some parents who have not chosen that as well. All right, so that's the stages of change theory. So this is, for you to think of, it sounds like most of the parents who are asking questions are probably in contemplation or preparation. You're trying to learn things so you can address this topic. But those of you who are professionals and are working with other parents, you might have, people that are in pre-contemplation and don't really want to talk about it. So we want to accept people where they are. And we're sort of gently nudging people, right? So we might give them some information, some resources and say, we give these to all parents. These are for you. You can throw it away if you're not interested, but we want to make sure you have access to it. Another great resource too is amaze.org. I'm putting it in the chat. Oh, I'm sorry. I was about to just send that to you, Maria. That has some Spanish videos as well, which might be a really helpful tool. There's also, I'm going to look up the website. I do some work. There's a few young women who are from Guatemala, who I work with around sexuality. They're in high school and they're in my town. And I do have some Spanish handouts too. I don't know if I could share some of those as well from the curriculum. Or Christine, you have access to the Spanish handouts in the curriculum as well. You could share with parents too. But I found a website for them. So it's for adolescents that's in Spanish. So I'll find that for you by the end, or I'll get it to Maria after and she can send it out too. So it's a website on, for adolescents who speak Spanish or, read Spanish. Okay. So just a couple things. I've kind of talked about all of this here, around pre-contemplation, but one question that you can ask people is, what worries you about this? So if you're working with a parent who says, oh boy, I don't want to talk about that, you can say, tell me what worries you about that. So that's a question that we can really kind of find out what's underneath it. So that would be a question that you can ask someone in pre-contemplation. We already talked about contemplation, pros and cons, but what we don't want to push no matter what. It's not our agenda. We're not pushing people. We're just helping people explore the pros and cons. And then I already talked about pros and cons, and then preparation. Again, we still don't push. It's still the person. We can't change other people. They can only change themselves. So that's just a few other points I wanted to make. I think there might be a question. Okay. My son touches others. People say it's silly, but he is almost a teenager and I'm afraid he will get in trouble with the police if he touches others at school. Yeah, I think you're smart to worry about that. I usually push his hands down and give him something to hold, especially when I'm attending virtual school. Okay. All right. So yes, I think it's really important for us to teach young kids about what's okay to do as far as touching others and healthy boundaries. And, the way I do it is teach the different types of relationships and then the different kinds of touch that you do in those relationships. So if it's a close family member or a friend, you can hug that person. Always good to ask first. But other than that, we don't really hug and touch other people. So I think that's kind of helps sort of, there's only certain people that we hug and touch. And maybe it's a partner when you get older, because it sounds like almost a teenager. So when you get older, you may be in a romantic sexual relationship and you might touch a partner then. So I think it's really important that you teach healthy boundaries, because there are people who have been charged with sex crimes or assault because they didn't understand boundaries, not because they are a predator, but because of lack of education. So that's another thing, another reason to talk about healthy sexuality and relationships, to avoid being charged with a sex crime as well. All right, another question. My daughter is 3 years old and I'm worried that she won't be able to understand someone may want to touch her inappropriately. Okay, yeah, so again, who is allowed to touch you and when? And also, what's really hard is that sometimes people with disabilities don't get a lot of touch too. So how can you meet those touch needs as well? And like the person who mentioned the son holding something too. So are they getting some of that touch need met by you hugging them as a parent? They have something that's soft and feels good on their skin. So that's another thing to think about, is how do you get your touch needs met? And then who is it okay to touch you or not touch you, and why? and I don't know how to let her know that nobody should touch her. Well, it's not that no one should touch her, it's just that certain people can't touch her. So these are the people that can touch you, and you get to say whether you want that touch or not, always. So if, again, that idea around the 6-year-old and what we want to teach, we want to think about if we say, Christine, go touch, go give Maria a hug, go give Aunt Maria a hug. And Christine says, I don't want to. And we say, it'll hurt Aunt Maria's feelings if you don't. So what we're teaching is your needs don't matter, Christine. Just Maria's feelings matter. And we want to say, okay, it's time to say goodbye to Aunt Maria. How would you like to say goodbye? Would you like to wave? Would you like to hug? Would you like to just smile and say goodbye? How do you want to say goodbye? You're in charge of your body and what you do with your body. So sometimes, we're teaching this idea of body autonomy by how we interact with other people too. And the child might say, I want to hug Aunt Maria. Okay, great, come on over. But we want to give them that choice and respect if they feel uncomfortable touching people in certain ways. Because the message we're giving there is, it's your body, you get to decide, and I'm going to respect your wishes. And that's a helpful tool. So I see that Patricia's hand is up, but I don't know if you want her to put the question in or is it okay if she unmutes? I don't know the rules.
There's no specific rule, just making sure that we're keeping things confidential. So no using names, of your child or of anyone else in the story would be great.
Right. Patricia, did you have a question?
Gracias, Jackie. La pregunta la puse en el chat, es acerca del pediatra. Él dice que en cuanto mi hija tenga su periodo la va a poner en pastillas anticonceptivas y quiero saber si yo me puedo rehusar a hacer eso. Ella es no verbal, ella no habla.
Maria. Maria might be frozen. Are you frozen, Maria? Are you good? You're good? Okay. Do you mind interpreting? Okay, sorry.
Yes, Miss Iris, go ahead.
No escuchaba la traducción, perdón. Es que estaba en español. Digo en inglés, sí, en español.
Welcome, Catherine, to our limitations in technology.
That's all right.
We're always figuring out something new.
Okay.
So the question was if the parent can deny given the prescribed birth control to the individual.
Yes. Yeah, so the question around a pediatrician told the parent that when the daughter gets her period, he'll prescribe birth control for her. Can I disagree? Of course you can disagree. And maybe even talk to your child about what they want. Do they, would not give her those pills. Yeah, a doctor can't make you or your daughter take anything. And I guess I would be curious why the pediatrician is suggesting that. And are they suggesting it because they're worried about sort of hygiene aspect and how will she care for her period? But if you're not worried about that then I'm not sure why the pediatrician is worried about that. So, you absolutely can refuse that, but it might be a great conversation to have around why is he suggesting that? I know that sometimes people worry that the child will be abused. And so they feel like, well, at least if they're abused, they won't get pregnant. But, that's frightening, right? To think of that that's what you would use birth control for. So we really want to give them a lot of information around their periods and birth control and whether you want to take it or not. Again, it's kind of like bodily autonomy. If we want to teach, it's your body. You get to decide whether to hug Aunt Maria. It's your body. You get to decide whether to take birth control. That's an important message for everyone to get, because then there's this sense of empowerment and I'm in charge. And then of course, there's always times as parents when you may not agree with your child around what's okay or not okay. And sometimes we might have to give medication and the child doesn't want it. I mean, I remember my son being little and had pink eye and having to hold him down and squirt stuff in his eye, right? I mean, sometimes we do that for health reasons, but if there's no health reason, we don't want to force stuff on our kids.
Really quick, Catherine, the other consideration, I don't know if the pediatrician was concerned about this, but they may be concerned with cramping or pain associated with periods. And so if your child can communicate when they're in pain, then you will know and you can give them medication to deal with the pain.
Right.
But if they can't, that might be something to think about. But
Exactly.
Either way, the doctor is not in charge of what medications you give your child.
Right. Yeah. And so, having that conversation to find out what his thinking is would be helpful, because then you would know, sort of, so the other thing is, so somebody wrote, my daughter's doctor put our daughter on the pill so she would not have her period or have her period. The hormones help her bone density. Yeah, so there may be a medical reason that the doctor is curious about that, wanting to do this. So finding out why, tell me why, asking those questions. How do you give positive, oh, did I already do that one? Give positive messages. I think I already did that one, right? Okay. So that she would have it. Oh, so she'd have her period. Okay. Yes. Yeah. So it's okay not to bleed, but it isn't okay not to bleed if you have a certain condition. So that's, might be part of it, is making sure that the child bleeds. It could be like polycystic ovaries or something. And that would be the reason that you want to make sure that someone's bleeding. So there's different, finding out why. There's nothing, the pill is a very safe medication. So that might be the question for you. If the doctor's suggesting it and you're saying no, what worries you about it? And talk about that. I don't think it's safe to take birth control pills. It's actually very safe to take birth control pills. It can reduce different kinds of cancer in people. The doses is so low now. When it first came out, the doses was much higher and people were having health complications, but now the doses are so low. So I think that it's not a bad medication, birth control pills, and there's actually some health benefits to being on the pill. We kind of worry that we're supposed to bleed, we're supposed to do all this stuff. And, it's okay not to bleed. Some people choose not to bleed, whether they have a disability or not. When we used to have really large families and we lived on farms, women had 150 periods in their lifetime because they were pregnant and nursing and they didn't have their period. Now we have 450 periods in our lifetime because we have fewer children. And so it's okay not to bleed unless you have a certain medical condition where you must bleed. There's also lots and lots of other birth control options, not just the pill. Exactly. So, and some of those might work better. Yeah. So it's not, I don't think you should be afraid of birth control pills, but understand why a doctor wants to put your daughter on them, and talk about your fears around it or what's bothering you about it. Yep. Great. All right. So I'm going to share my screen again and keep going. I'm just checking the time. All right. So just a few more things if you're supporting parents, and as you can, you can sort of see, you're welcome. You can see that there's lots of questions that parents have around this. So that's one way to support parents, is to help them sort out some of these decisions and think through, should I put my daughter on birth control? So just a few things with working with parents. Acknowledge the barriers that parents face. And I think that's really important. This is a very difficult topic. And if your child has a disability, there is more pressure, feeling like, what if I don't do this right? And so really acknowledging those barriers, that this isn't easy to talk about, especially many people said that it's a taboo topic in their culture or in their families. And so it's really difficult to talk about taboo things. So acknowledge those barriers, find out what worries parents that you might be supporting. So asking yourself, why are you worried about that particular thing, or asking parents. And, partnering with parents. That's what parents tell me all the time. I just, I don't like it when people come in and tell me what I need to do for my kid. So having the conversations with parents and partnering with them is how we want to look at that relationship, and give lots of empathy to parents for the struggles they may have. All right, so I'm looking, there's a few questions. How much sex education should school do for students with intellectual disabilities? So I believe that what we want to do is base the content on the age of the child. So if the child is in high school and they're 17 years old, what does every 17-year-old need to know about? They need to know about their bodies. They need to know about pregnancy, and reproduction. They need to know about relationships. Someone with a disability needs the same information. It might be taught a little bit differently, but need that same information. And sometimes people with intellectual and developmental disabilities need even more information, like different types of relationships and how do you touch, because those are things that we learn. They're very subtly taught to us. And so we have to teach them very concretely to students with intellectual developmental disabilities. Can the IEP team add goals to address inappropriate behaviors? Yes, they can. I mean, I guess what I'm saying is you can put in goals around sexuality education for your child that might help with inappropriate behaviors. And depending on what the inappropriate behavior is, and we're going to talk about behaviors in just a minute as well. And Christine's saying they should probably consult with a BCBA or a behavior specialist too. Yeah, so it's kind of a bigger question, like what is the behavior and how do we stop it in the moment? And then how do we teach a particular skill or an alternative behavior that's more socially acceptable? So it kind of depends, but I think that can be part of the IEP, as can sexuality education, putting it in as a goal. What can I do if the school doesn't see this as an issue? It's very difficult to get access to an advocate if you speak other languages like Korean or Spanish. So an advocate in schools, is that what you mean by that? Yeah, and I guess I wonder, great. I wonder, is the school providing translation or interpretation for meeting with a teacher? so that you can communicate. I don't know. I think they should. I don't know what the sort of laws are or rules are in different schools. Do you know, Christine, about that piece around access?
Technically, everything should always be given in the language of the person's preference. So paperwork, meetings need interpretation, phone calls home, any communication, the school should be providing interpreters. Now, if you meet with an advocate on your own time, I think that might be a separate issue unless the school is supporting the interpreter or the, help me, words, the professional. So like if they have hired someone to work with the family, then yes, they are required to provide interpreters, but I don't know, like if you're calling an advocate, you might have to provide interpreters, or if they are funded, Maria, I think this is right, if they receive Medicaid funding or any federal funding, they are required to provide interpreters as well.
That is on the medical aspect, and that is only for Alabama, as far as I understand. But I would say that if the parent feels that, they are not being provided equally access and participation in the school setting, they should be able to reach out to the local parent education training or their local advocacy agency and let them know about this. Because yes, you're right. Every information and documents should be able to be translated into the parent's primary language. And on those meetings, they should be an interpreter if the parents request them.
Yeah, I would think an IEP meeting, you would have to have an interpreter as well, and it would be required,
But the IEP meetings there's so much going on in an IEP meeting that you probably want to have a separate conversation about this. The other thing is organizations like HICA, like AKEEP are, supporting educational aspects as well. And so they may be able to support a family additionally outside of the IEP meetings or what the school is mandated to provide. Because yeah, it gets a little fuzzy when you are not in a required meeting for the school.
Okay, right. So it sounds like there is an interpreter at the meetings, but they only want to focus on math, English, and speech. But I do think that the IEP is your meeting and your child's meeting and not their meeting. So, even what might help is, can we talk about health for my child? Let's, get some health goals in there. And even talking about what worries you. And if your child is touching their sexual parts in a public place, that is a worry for anyone, right? Because they could get in trouble, or someone might approach them thinking, they're really vulnerable, or so I think bringing up safety and health might be the angle to use in the meeting. Christine.
They do pull this card pretty often of, well, we're not seeing that in school, so we're not going to address it.
Oh.
So that's a very common response I have seen, but that's not true. They don't have to see it at school for it to be addressed, in terms of you can do a social story about public and private at school.
Yes.
I mean, that is still something that should be addressed. So don't let if you're a parent listening, don't let well, it's not technically at school, so we don't see it, so we don't address it. That's not true. They can create materials for you to use at home. They can teach the lessons at school. Gen Ed teenagers don't have sex at school, but they still teach sex ed.
Mm-hmm.
So just because it's a behavior that's happening outside of school does not mean that it should not be addressed by the school.
And I guess too, what are the state regulations or requirements for sexuality education or health education?
In Alabama, they're not ideal. So in Alabama, they require provision of AIDS and HIV prevention information and some healthy relationship topics, but they do not require sex ed. And if you do teach sex ed, it has to be abstinence forward, meaning that abstinence is the only way to guarantee no unwanted pregnancies and STDs. But frighteningly, 55% of pregnancies in Alabama are unplanned.
Right.
So it's rough out here. Private schools also are not required to cover sex ed. There's no regulation there. So it's rough.
If the school district has some kind of health requirement,
They
using
should.
that.
Yes, absolutely. There should be a health requirement. There should be HIV. There should be healthy relationships, but also challenging behavior. So if you frame it as this is problem behavior, then they have to provide instructional supports to deal with the problem behavior. So if that's a social story about not touching your penis in public, that is an instructional strategy. So yeah, that could be a way to get around it.
Yes, good, great, thank you. All right, keep those questions coming, and we're going to do a little bit more. I think we'll do, I guess, I'll keep moving and we'll see where we end up. All right, so just a couple things in working with parents is, and I just talked about this, there's a myth that you should focus on the cognitive age of the child. So sometimes people will say, well, yeah, he's 18, but he has a cognitive age of 7. So we're going to teach what 7-year-olds need. No, we want to base it on the biological age. If we talk about it, they'll do it, just not true. I mentioned that earlier. That sort of that idea about talking about it might encourage, or giving positive messages might encourage. It does not make people have sex more. Sex education is teaching them to have sex. And I mentioned that earlier as well. It isn't, it's about relationships. And yes, a piece of it is about sex and reproduction, but a lot of it is social skills and, relationships and consent and all kinds of topics that aren't necessarily related to sex. And sexuality education teaches someone else's values. And high quality sexuality education should be values neutral. So I teach facts. I don't say, yeah, you should do this or you shouldn't do that, or that's not my role. My role is to give factual information. Parents' role is to give facts and what they believe. But as a sexuality educator, I do not share my values around sexuality. The only values that I share are more common values, like it's important to respect people and listen to them, or it's important to get consent from before you touch someone. Those are things that we would all agree on, but other topics like whether you should have sex with your boyfriend or something like that, that's just not my role. My role is to help people sort it out themselves and give them factual information. Christine, I want to do should I do some professional scenarios or some parent scenarios?
Maria, off the top of your head, what would you say are percent professionals?
I think we have half and half.
Maybe one of each.
Okay, let's do that then. All right. Okay, let me think about. All right, so let's do this. Let's do number 4. So you're a professional and a parent comes to you and tells you her son says that he's in love with a man. The parent is really upset. In the chat, what are some things you could do as a professional? And those of you who are parents, what is something you would like the professional to do. All right. First, figure out why they're upset. Yeah. So really listening and tell me more. What did you hear? Yeah. Is it because they may be gay or they're saying they're in love? Right. What's the parent upset about? And I think a lot of empathy for parents around, sometimes when we hear these things, it's really difficult. We had a different idea about our children. Either they would never be in a relationship or that if they were, they would be in a heterosexual relationship. And so really being there for the parent and helping them sort out what worries them. Are they in love with someone who's too old? Right, exactly. Yeah, so what is the main concern? And be there for the parent and help them talk about it. I also think this one shows me that the parent has a good relationship with the child, that the child told the parent this. So you can do some like, good for you. You obviously have shown that you're approachable and, you can be asked things or you can be told things. And then for the professional, good for you that the parent came to you and said, I'm really upset. That tells me something as well. So reframe it for the parent as a positive. Sort of like that he came to you, you can talk about values, you can talk about yes, absolutely. Great. All right, I got a few questions in the chat. So let me do those and then we'll do a parent scenario. How can I address his touching from the sensory aspect? So I'm assuming the person who's touching his sexual parts in a public place. Yes, okay, great. Yeah, so I know that there was a student who was on a bus and he would always put his hand down his pants and touch his sexual parts. And what they did was they gave him lots of different types of fabric and he just, gets on the bus, pulls out the different fabrics and uses those. So it's substituting, it's an alternate behavior, if that's what you mean by the sensory aspect. So another way to meet that need. That would be, and it doesn't have to be that, but something that is going to make him feel relaxed because really, that's, you're able to find ways to relax yourself in public that are more, that are socially acceptable and it's okay. All right, so how can I teach the fact, but also teach him my personal values because of my religious beliefs? In my culture, it's sex before marriage. So do you mean your culture, it's sex, you have to be married to have sex? Is that? I'm guessing that's okay. Yeah. So I would, a couple things to say about that. I want to find the exact question again. I think one of the things that, we do have this idea that you should not have sex before marriage. And that idea really came from a time when people got married much younger. And so I think, if you say you can't have sex until you're married and people don't get married till they're 28, that's a really long time. And I think it is absolutely fine to say your value and why you think that is important. But also we have to think about, are my values helping my child or are they hurting my child or hindering my child? And I think that's something we have to sort of reflect on as parents is, here are the facts and here's my value. I believe that you should wait until you're married to have sex. You may choose differently, but this is why I think it's important, and say why, not just you need to wait till you're married, but this is what I believe and this is why I believe it. And then support your child in making their own decisions, because if we don't let them make their own decisions, they often will sneak around us and then we have no influence at all. And so even if it's difficult for us, if our child chooses to do something that goes against our values, we do want them to talk to us. So we have to think about that as well. But as far as facts go, you could give facts around some, many people are sexual before marriage. I think it's 96% of people. That's a fact. I don't know if you want to share that. You might not want to share that fact, but I'm just trying to think of what sort of facts there are. Yeah, so I don't have much more to say about that one, but if other people have things to add. I'm not even sure my child will ever get married. Someone said, is this even relevant to think and talk about? The topic of sexuality or sex in marriage? Was that it? Yeah, okay. Sexuality, yeah. Well, I think that's a really an interesting thing to think about. Like, is it possible for your child to be in a sexual romantic relationship? Sometimes as parents, we don't think that they are. And turns out they could actually be in a relationship, but sometimes they have a level of disability that maybe they aren't going to be in a relationship, a marriage in particular. So I think we have to be very honest with ourselves about that. But also, there's a lot more than sex in sexuality education. So there's, safety, there's relationships, different kinds of relationships. So I think we need to be talking about sexuality education and relationship education with our kids, no matter what their disability is. And, will they be who knows, right? We don't really know what will happen for our children. So I think there's lots to talk about. And Christine wrote, they may not be married, but they may have crushes, feelings, masturbation. Yeah, so they're still going to go through biology, and the hormones are still going to be in their body. And I know Laura, who did the training 2 weeks ago, talked about she didn't think her child was going to be in a relationship, and then it was like this whole transformation for her to believe, like, wow, maybe he actually could. So is the barrier your views of your child, or is it really their disability? And it might be very hard to be in a relationship. Great, so lots of other topics. Okay, so, but great question. The thing that makes me scared if he's an abuser. Okay, so being abused in any relationship is something that so whether the child will be abused or your child will be the abuser. And that's another important thing to teach. Like, what if you are attracted to somebody, you cannot follow them around everywhere and stalk them, right? That scares them. So if you want to find out what the meaning behind the behavior is, and I'm about to do a scenario. So let's use this one as the example. We'll use, that your child is, just going to scoot through some of this. I'll go back to this.
And we cannot see your screen at the moment.
Oh, you can't. Let me, okay. Good.
If we're supposed to be.
Let me get it up here again. Okay, so let's talk about afraid that your child will be the abuser. Is there a certain behavior that we could use stalking as an example, of a behavior? So we can use that unless there's another one you want to use. But let's say that you see that your son or daughter is following someone around and the person looks scared. You're going to, this is a format you can use. You want to name the behavior, or if it's comment, as you see or hear it. So you can say, I see that you're following so-and-so everywhere they go. Can you tell me why you're doing that? Now, again, I don't know your children's specifics, they might be able to answer that and say, she's so cute, or I want her to be my girlfriend, or, you know, whatever it might be. Like, can you tell me why you're doing that? And then you want to decide what message you want to give. So you're going to have to stop. I understand that you have a crush on this person. But when you follow someone around, it scares them. So you have to stop. Let's talk about ways you can get to know people that aren't scary for them. So how could you let this person know, or get to know this person in a different way that isn't scary? So we want to teach a different skill that's more acceptable. So maybe it's talking, again, I don't know the scenario. Maybe it's talking to, you know, seeing if she, you know, wants to sit and chat about something, have coffee. I don't know how old the kids are. Sit together in the cafeteria. That would be different, asking someone to sit with you in the cafeteria than following them around, right? They may say no, and then you have to accept the no. But let's try to come up with ways that aren't scary for other people and for you to get to know people. So that's what we're doing. We're stopping behavior that might be inappropriate and teaching a substitute skill. So let's use this example. Oh, yeah, let's do this first one here. You are at McDonald's having lunch with your son. When you return from using the restroom, you find your son masturbating at the table. How do you respond? So any ideas in the chat about how you would respond? What could you do as a parent, or what could a parent do? I'll wait for a few responses. Leave the place, hoping no one saw. Yep, so we're going to say, I see you're touching your sexual parts in a public place. You need to stop. Let's go. That's an activity for a private place like your bedroom. Yeah, so when we teach public and private, we want to teach your bedroom at home with the door closed, or the bathroom at home with the door closed. Those are really the only private places that a young person has. So we want to teach those. So there's only certain things there's certain things you can do in public, and some things you can't do in public. And this is one of them. You have to do that in private. That is for private, just like changing your clothes, just like going to the bathroom, just like picking your nose. Those are private behaviors. All right. Any other thoughts about that one? Hands out of pants. We need to go wash our hands now. Yep, so get your hands out of your pants. So you're just being sort of light. You're not shaming or yelling or anything, but you know, get your hands out of your pants. We're gonna go wash your hands, and we got to get going so we can stop the behavior. But then we want to teach something as well, because the behavior will continue unless we teach the difference. How about while you're at a grocery store, you see your daughter give a big hug to the store clerk. So this is someone that the daughter doesn't even know. What can you do? In private, we want to say the bathroom at home, not the restroom in school, not the rest. Those are public. Can you hear me okay? Okay, I just your internet is unstable. So public, public restrooms, we don't want to masturbate in. The mall, the bathroom at school, it's for home bathroom, yes. So Christine's saying, I'm so about this scenario in the drugstore. I'm so sorry, sir. That is a stranger. We don't touch strangers. Yeah, yes. And how can you, right, we don't touch strangers. And would you like to say hello to this stranger? What might be a substitute, right? So strangers we don't touch, but you can say hi or you can wave. Yeah. Yep. Exactly. So we want to stop the behavior. We want to teach the stranger too. Oh, you don't know each other, so you're just going to say hello. We don't hug people we don't know. So we're also teaching the stranger, because sometimes strangers will say, oh, it's fine, they didn't mean anything. Which is what they're doing, is they're treating the person like a child. So a 3-year-old accidentally hugs someone, we say, oh, they didn't mean anything. And they probably didn't, right? And they don't. But when they're 18, we want to expect the same behavior, whether they have a disability or not. And so we might have to teach that behavior. Great. And if you want to hug someone, you can hug mom or dad. Right. Yeah. Who can you hug? Yes. Great. I think there was another question. Okay. I'm going to stop sharing. We'll do another question and then we'll see where we are. So one of my consumers is a young adult, and he has expressed to his parents that he wants to be sexually active when he turns 18. But the family's having a hard time making sure how to help him be safe, but learn about consent. Yeah, so there's a lot of skills to teach there, right? So we want to teach, what is a healthy relationship? How do you know if a relationship is healthy or not? So some of those things. We also want to teach what is consent, that you always have to get consent. Ask someone before you touch them. And also if you say yes or no, you have the right to say no as well. And when I teach consent, I teach two yeses. Did the person say yes? And was it freely chosen? So the question, and I could give you the English and Spanish handout on consent too, if you'd like. I'm going to start taking some notes. We do have that. Oh, actually you do too, right? But I'll get it. And then Maria, if you don't mind sending it out, that would be wonderful. So freely chosen means that the person was able to make a decision without being threatened, forced, lied to, pressured, intimidated, right? They were able to, they could say yes or no, and nothing, they were respected and heard. So if we're looking at a scenario and we say, is this consent? The first thing we want to say is, did the person say yes? Yeah, they said yes. Okay. The second question is, was it freely chosen? And if the answer is nope, they were intimidated, then it's not consent. Because I can hold a gun to your head and make you say yes. It still doesn't mean you said yes. You had to say yes. And so pressure and threats and all those things make people say yes. And we don't want to make anybody do anything. We want to ask somebody and respect their response. So that's something we want to teach. Consent, because that seems like that's one of the issues that is the most important for these parents. And I think too, think about where the parents are. Are they in contemplation? Sounds like it to me. They're kind of like, and really thinking about what would be good about talking to your child about sexuality and relationships. What are the positive things that could come out of that? What are the negative things? I don't know many negative things, but they may have a few. It might give them ideas, and you can say is not true. It doesn't encourage or anything. It gives them information to make healthy choices. So that would be, I would kind of think about pros and cons with those families too. And then I'll also give you, there's 2 other resources that aren't specific to parents, but they're specific to people with disabilities. I'll put those in the chat. Actually, let me get I'll get the link for you and put it in the chat too. But one is the National Council for Independent Living. And I'm going to share my screen and show you the videos, but these are short videos. They are taught by people with developmental disabilities for people with developmental disabilities. But they're 3 or 4 minutes, and it's someone with a disability talking about it. So these would be great things to share with the family, that they could sit with their child and watch them and talk about it. So that's one resource. I'll just put that in there now. And I can also send this to Maria. You can have a big list if you don't get it now. And then another one that's really helpful for self-advocates is the Organization for Autism Research. And I don't know if this is in Spanish as well, but there's lots of different topics here. So you could start with healthy relationships and talk with your child about that. Or you can tell the parent, this resource is great. You can talk to them about it. You can talk about consent with them. Dating 101. So there's some great, so let's click on Dating 101. You know, what's a crush? How do I know if I have a crush or if someone has a crush on me? How do you handle crushes? Talking about your crush, flirting, asking someone out, handling rejection. So you can click on these different ones and read them together, the parent and the child. So it's written for people with developmental disabilities. It's pretty text heavy, I think. So there's also, if you go back to the main page, here it is. There's also a podcast. So the person with the disability can listen to these and learn as well. So there's lots of ways to talk about, there's lots of ways for the child to learn about sexuality as well. So those are a couple resources that I really recommend because they're written for people with disabilities. So yeah, so that might help when you're supporting parents around teaching their children. Plus, there's also a resource list for the parents themselves too. But these are specific for people with disabilities. So they're written in a way that's more cognitively accessible. Any other questions at this point? And then I'll go back to my And do we keep going? I know you said 90 minutes, but maybe longer. Do we just go and should I like kind of wrap up and then we'll see if there's any more questions, or do I just keep talking?
We would love to have you keep talking. Obviously, you have so much to share. But I think we could probably move into the question portion now. Maria and Doris, was there anything specific that you wanted addressed before questions start?
I don't see, I was putting the questions and sending them to Katherine as they were coming in. So I don't see any new questions in the chat or, sent to me privately. So
Maria, could you resend all the questionnaires and the
yes.
Okay,
ACDD?
yes.
Yeah, we want to make sure that everybody has an opportunity to fill out the questionnaire for ACDD and the questionnaire for us, the HTRAN. So please, it doesn't take you very long, maybe about 5 minutes per, I think. So,
Dr.
while
Hill,
we're finishing up, what?
You're making promises that we can't keep. So the one for Survey Monkey, that one will only take you a short amount of time.
Okay.
The one for me, you're in for a bit of an adventure. So
Okay, let the adventure begin then. Okay.
So it is a bit, but the ACDD one is super quick and it's really easy. And those of you who've attended our trainings before have probably filled out a bunch of them. So you probably have it memorized by now.
Mm-hmm.
And I could also just do kind of a wrap and then they
Mhm.
can fill out the things. So
That would
Great,
be
there it
wonderful.
is. All right, so let's just talk, if you could put in the chat, based on what we talked about, whether you're a parent or you're supporting parents, what's one thing you can do to help either your own child be sexually healthy and learn about sexuality, or how can you promote families and, supporting families and talking about this? So I'd love to hear your thoughts, just thinking about all that we've talked about, something that you can, one thing you'd like to do, or one thing you learned. And I can wrap it up and also take any more questions, and you can fill out your survey.
As you start to wrap it up, I'd like to thank Ms. Luciano and Ms. Mobius for being our interpreters today. And thank you, Katherine, for presenting.
You're welcome.
And I think our next training is on guardianship from ADAP. Do we have a date yet, Maria?
Yes, it will be on Tuesday, March the 29th at 10:00 a.m. So look for that information coming up.
Great. Just a few things that are in here. I think that telling families how universal this issue is to other families. Yes. I could assess all the parents I talked to of where they are in the contemplation model. Yes. So they feel free to comment and ask. Great. I love the idea of asking children how they'd like to say hi or goodbye without forcing anything. I have a quick question about whether it's a good idea to educate your own son about sex, or have someone else like a teacher or counselor educate. It's a really good question. I think that sometimes it's easier for a professional to talk to the children. Like, I am better at talking to other people's children than my own children, right? Because I have this emotional kind of attachment, and I'm worried and all those things. But when I'm talking to other people's kids, I can sometimes be more effective. So I think both would be great. So there is an opportunity for someone else that you feel like is knowledgeable and could support your son, but also you too. So if he needed anything, he could come to you, and that you also can put in your values about things as well. So I think both are really good, rather than one or the other.
Lots of good comments, and thank you for this presentation. Thank you to Auburn University for having such a knowledgeable speaker. So we all agree. So thank you.
Nice. Great.
And something I kind of wanted to say before we wrap up is, as professionals, I often am the one in the room that says the thing that makes other people uncomfortable. And I understand as a professional, this can be a dicey proposition. So I don't want to just say, well, of course, just bring sex ed to your school or bring sex ed to your organization. But I think, I went to the training with Katherine. The majority of the people there were from very conservative places, Texas, Utah. I was from Alabama. Like, this is happening in places that you would think, oh no, there'd be no way. But it is true. Like, these people are going to these training agencies, are paying for people to get this training because they see there's a need. So I think a lot of times administrators don't know where to start. And if you show up and say, hey, look, I just went to this training. It comes with a parent training manual, it comes with a staff training manual, and it comes with a sex ed manual for young people. Like, it is truly the package. And sometimes administrators are just looking for a solution. They don't want to hear the problem, or they're overwhelmed by the problem. So if you show up and you're like, like, I don't know all the answers, but I can go get a training and I can learn more. I found that can be effective, that you aren't always up against the problem that you think you're up against, right? You're up against a problem of, we don't know enough, rather than people's refusal. So you know, as soon as I bring this up to families, like we've talked to families, particularly with the Eagles program, that are like, thank God someone's doing it. Thank God y'all are doing it, because I don't know how and I don't know what to do. So thank y'all. So the attitude is actually the opposite of what I was expecting, which was like, I'm gonna have to go in guns blazing and be like, you're gonna sit through this training. But the majority of parents are like, thank goodness, please tell me all the things. I don't know what I'm doing. Help. They're just reaching out for whatever they can get their hands on. And we saw that in the last presentation that was put on by Laura. There were so many parents in the comment section saying, what is your company's name? Where do these trainings happen? How do I get my kid into a class? There are, you know, so it's, I'm talking a lot, but basically as a professional, you have a lot more power and input than you think you do, because often, as long as you just start the conversation, the tension sometimes will go out of the room, because people are like, oh my gosh, thank goodness somebody said it. Whew, thank goodness somebody's naming the problem, you know, because everybody's dealing with it. Everybody's dealing with it, and they just don't have the words to ask for help.
Right. Great.
So people just saying thank you for the presentation, and they are looking forward for the handouts and the resources. So we will be sending, once we have the, you know, the all the emails of all the people that register, we'll be sending the presentation, the handout, and also the link for you guys to go and review it at the YouTube channel. So Dr. Drew, can you put that YouTube channel link where parents and professionals could go back and review previous presentations from others professionals that we have, you know, presented on different topics. And I'll be also sending the list of resources to everybody that attended today.
I just put the YouTube channel in the chat. You can also subscribe to it, and that way you will get a notification when a new video goes up. So we already have the video from Laura's presentation for parents up and recorded. We have presentations on COVID, compensatory services for family. I mean, there's a lot in there. So, you know, just keep looking back, and, you know, we do these presentations every month. It's guardianship, and then next month is, or month after that is early intervention. Month after that is speech and communication. So, I mean, these are important topics for all of your families probably at some point. So just keep us in mind.
And for our parents that they speak other language, you know, that is not English, on the YouTube, there is an area where you could have automatic translation, and you could view the subtitles on your preferred language. So I'll invite you to go and look at them and try to select, you know, any other language like Spanish, Korean, you know, Chinese, and you could have at least review. It might not be accurate 100%, but it's pretty close. So that's all I have on my end, Dr. Hill, Dr. Drew. Katherine, any last remarks?
No, I mean, I think I think Christine is making a great point that people want to talk about this and to not be afraid to bring it up, because I've had lots of experiences where as soon as you sit down with someone and you close the door, they're just so happy to finally have someone to talk to. So, and you don't have to know everything as a professional, just, you know, open up the conversation and you can always find out answers. You know, I think sometimes people feel like they have to be the complete expert before they open their mouths, and you don't, you really don't. You just getting the conversation going, you're facilitating, you're discussing, you're giving resources, and you're normalizing the topic, which is a great thing. Great, everybody. I'm going to gather all those materials and get them to you, Maria, so you can send them.
Perfect, thank you. And Katherine, would it be okay if we share your contact information
Yes.
along with that email? Yes?
Absolutely. I can
Perfect.
put it in there.
Somebody just asked that.
Absolutely. Yes, please reach out.
And her trainings are excellent. If you can get someone to pay for them, that is the, if you're a professional, make your company or your organization pay. That's what professional development funds are for. But they have other resources on there if you're not able to access the training. And I'm happy to have obviously happy to have conversations about this with anyone. So, you know, we're available, and I'm free. But you also get what you pay for. So
I just want to
mind.
say, oh, sorry. I just want to say that please take a moment to answer these surveys, because they will help us to fulfill our grant, and also allowed, you know, ACDD to see that these educational programs are important and relevant to parents and professionals, so that they could still, you know, providing funding for other organizations, you know, in the future, to ensure that people with developmental disabilities have access to this very valuable information. And I will be sending these links also on the email. So it's going to be a lengthy email, but, you know, so please help us there.
Wonderful. Well, thanks to everyone for being here. I hope everyone has a great rest of their day, and we'll see you next month at our training, and you'll be getting an email soon. Thank y'all so much.
I think we can stop recording.